There you go. Dr. Mazen is a general dentist. He was from North Carolina and then he decided to leave the state for dental school, and now I think he's based in Maryland. I'm gonna let him introduce himself and then inshallah we'll get started on the presentation.
Assalamu alaikum, everyone. I'm very humbled that you guys asked me to be one of the guest speakers for today. I hope I can give you some helpful information about the field if you're interested. Like Ari said, I was born in Sudan and I lived there for a few years before um, coming to the U.S. And I was raised in North Carolina and then went to betrayed everybody in North Carolina and went to dental school in Maryland. And now I'm actually in North Dakota as of very recently. So I'm here for about a year, and then I have an exciting opportunity to go abroad for a year, and then inshallah I'll be back in the Northeast. Um, but yeah, I'm very happy to be here and very happy to answer any questions you guys have.
Awesome. Thank you so much, Mazen. All right, I'm gonna share the presentation. Give me one second. I'm trying to figure out how to do it. All right. Can you guys see my screen?
Yes, just if you could make it in the presentation mode, Ari, we should be fine.
All
Yep,
right.
that's good. Thank you.
All right, awesome. Let's get started. All right. So Dr. Maza, I'll let you kind of talk a little bit about your journey, how you decided on dentistry. I know you already kind of told us a little bit about your background, but give us a little bit more, and so the floor is all yours.
Yeah, yeah. So like I said, I was raised in North Carolina, and I was lucky enough to stay in North Carolina for undergrad. So I went to UNC Chapel Hill for undergrad, where I met Arij before then, but I think a few times I ran into her at UNC, and so. Um, but then after that, I actually left a little bit out. I went to North Carolina State University for a master's program in physiology, which really helped me a lot in terms of my school of once I went to dental school in terms of my didactic training. It was very, very helpful. And then after that, I actually when I was in dental school, Rach can probably speak about this as well. You know, I was very worried about loans and interest-based loans, and kind of something that I wanted to kind of steer away from as best as I could. And so I was looking at scholarship opportunities. And as you can tell from the picture, I'm kind of wearing my Air Force attire there. So I became an officer in the United States Air Force, where um, they have a scholarship, and all the military branches actually have it. It's called the HPSC, or the Health Profession Scholarships Program, and they pay essentially for your schooling depending on when you apply. So I got a 3 year scholarship that paid for the majority of my dental school. So alhamdulillah, I came out with very little loans afterwards. Um, but then afterwards, my dental school, I went to Andrews Air Force Base in Maryland, where I did my AGD, or my advanced education in dentistry training. Um, and some of my family also moved to Maryland, so I was fortunate enough to kind of stay around family for a little bit of time. But um, I can speak about that more once we get into the Q&A. But that's kind of the track that I took in terms of getting into my dental career.
Awesome. All right, so a little bit about me. I actually was born and I grew up in Greensboro, North Carolina. And then I went to UNC Chapel Hill, like Mazen, for undergrad, where I majored in public health, specifically nutrition. And then I actually decided to stay in North Carolina for dental school. So I went to ECU dental school. I'm still in ECU, a fourth year dental student, kind of wrapping up my education there. One of my biggest motivating factors to go to ECU was the tuition. It was very generous. I definitely didn't want to be like $500,000 in debt coming out of dental school. For me, it wasn't worth it to be a dentist and be in that much debt. And that's just kind of my personal opinion. Um, so I kind of went where I, could get an education, but not have to spend so much money. And also I wanted to stay close to home. So for me, like I knew that I liked being able to go home over the weekends, and that was really important. So I decided to stay in North Carolina, and I can kind of talk a little bit about my experience at ECU later when we get into the presentation, and sort of some of the other considerations that I had when I was choosing the school.
Yeah, so we can go ahead and just talk about what dentistry is in general. And so dentistry is a branch of healthcare, like the slide says, focused on prevention, diagnosis, and the treatment of conditions, not only related to your teeth, but your gums and your overall oral cavity or mouth. And so what dentists try to do is they try to help people kind of maintain a healthy, hygienic, and overall just good oral environment, which is essential for your overall health and well-being. And so with the advent of kind of microbiological studies and looking into microorganisms, we've seen that, a lot of systemic diseases are carried out by bacteria that are actually present in large amounts in the oral cavity. And so when we maintain kind of that balance in our oral cavity, doesn't necessarily mean we eliminate the risk of having these other comorbidities, but we definitely can reduce the risk of that being an issue down the road as our immune system tends to weaken and we get older and things like that. And so, but yeah, beyond treating cavities and performing cleanings, we're involved in educating patients about how to take care of their teeth in their oral cavity outside of the clinic. And so, you generally see a dentist if you're pretty kind of diligent about it, maybe once or twice a year. But at the end of the day, you're taking care of your own oral health at home. And so education is a very important and vital part of what we do.
So we do more than just clean teeth and, fix cavities, right? So just wanted to drive that point home.
And so why is oral health important for our overall health? And we kind of touched on that a little bit before. But for heart health, for example, poor oral hygiene can lead to gum disease, which has been linked with increased risk of heart disease and stroke due to the inflammation of the bacteria that's entering your bloodstream. And so the mouth is a very vascular place, and there's a lot of blood vessels that carry nutrients in and out of the mouth. But unfortunately, they can also carry microorganisms in and out of the mouth as well. And so, it's the first site of entry a lot of times for things because of, we eat with our mouths. And so it can be detrimental if we don't take care of our oral cavity. Gum disease also can make it harder to control blood sugar levels. And so we see kind of a correlation with diabetes and increased gum infections and also prolonged gum infections. And then pregnancy complications is also a big one to talk about too. And it's kind of a two-way street too, with the hormones that are kind of fluctuating during pregnancy. You see an increased incidence of gum disease as well. And then in digestive health, obviously healthy teeth are essential for proper chewing and function. And so not only, again, like Audrey said, we're not just concerned about fixing cavities and cleanings, we're also concerned with the function of your teeth. And so we replace teeth, we fix teeth so that you can use them to function in a way where you're eating, where you're speaking. This is something that a lot of people don't think about, is the way you speak is also kind of related to how your teeth are oriented in space. And so those are some other ways that taking care of your oral health is important for.
I'm going to chime in a little bit too about this point, because a lot of times patients will come to the dentist or even see like a dental student in the school setting, and they're always so surprised, like, why do you need to know my medical history? But these things are really important. One, we need to know that you're safe to stay in the chair. If you're someone who had like a stroke, a few months ago, and you're sitting in a chair and you have high blood pressure, then the risk of you having another episode in that chair is very likely. Another example will be, and this, I come across this a lot actually, where I'll see patients who have uncontrolled diabetes. Their A1C I've had someone who had an A1C of 13 actually, which is like super uncontrolled. Anything above 7 is uncontrolled, but this is like super uncontrolled. They have their blood pressure or their blood sugar was over 400, and they wanted me to take a tooth out, and they didn't understand why I couldn't take that tooth out. So I had to kind of explain to them. And I think, part of being a dental provider is also educating the public. When you have uncontrolled diabetes, it makes it so much harder for that extraction site to heal. The risk of complications just exponentially increase. So it's important that we take care of the systemic diseases before we do any sort of extraction, or because at the end of the day, it is a surgery. So a huge part of what we do is patient education, I would say.
And so this is really the important question, right? Like, and why a lot of you or whoever is watching this is interested in this discussion. Why did we choose dentistry? And a big thing for a lot of dentists and dental students currently is the work-life balance. And so I preach dentistry as a profession to a lot of people just because of the flexibility that provides in terms of work-life balance. And you can be a dentist and work 5 days a week, 6 days a week, 7 days a week, or you can work a day or two. And you don't necessarily have to stay within that specific parameter, right? You can make your own schedule. There's locum work, which means that you sign temporary contracts with specific clinics and work for a few months at a time and then move on and go somewhere else. And so obviously that's not the case for everyone, but there are opportunities for different kind of lifestyles in dentistry. The financial security is definitely a plus. We're kind of the frontline workers when it comes to oral health. And so specifically with general dentists. And so unlike medicine, where specialization is actually a requirement for you to kind of work in the healthcare system that we have here in the US, I believe the statistics are like 80% of graduates from dental school stay as general dentists. And so you don't need to pursue further education after being a general dentist, and you can still do good work because the need is very high for dentistry. Regardless of what you read online, what you see, it is not saturated. It may be saturated in places where people really want to live, but it is not saturated by any means. There's a high need for dentistry in the US. Again, there's no required residency, so as soon as you graduate, you can work right away. Direct patient care is obviously a big plus for people who are a little bit more social, more caring, more empathetic and sympathetic. And I believe, a lot of good dentists really excel in the field, and they're good dentists because they really care about patient care. And so as long as you put the patient's health and well-being as the primary kind of goal of your pursuing this career, you'll do very, very, very well. And then obviously the longstanding relationships with patients too. This is something that's definitely a benefit, but you don't need to be an extrovert to be a dentist. You can, it's definitely a plus, and I believe it's a plus for a lot of people who go into dentistry. But I don't want that to sway anybody from thinking, oh, I have to be super extroverted to be a dentist. You don't need to be. You just need to be someone who really cares about people and their well-being. And then obviously immediate impact, right? So a lot of times people come to us with toothaches. They come to us with acute symptoms that can be mediated and treated very quickly in the same appointment. And so people who pursue professional education, I always joke about this. We are masters of delayed gratification because we've been pursuing education for so long. We've been waiting for to finally reach that goal. With dentistry, I think it's really nice because you get that immediate gratification from having that impact on patients right away. And then this last point is very important. It's very creative and hands-on, and you can kind of put your own personal touch on everything that you do. Dentistry can be very subjective in terms of how you treat patients. Obviously, there's evidence-based dentistry that you follow, but within that, those parameters can be a little bit flexible to kind of put your own kind of touch on what you want to do. And you can pursue different avenues in dentistry. You can be a cosmetic dentist. You can be a dentist who kind of does bread and butter and just wants to make sure people are taken care of. You can do prosthetic work. You could do dentures. I don't know why people love dentures, but there are dentists who really love dentures. But it's important work, and people really need that. And so it's very flexible in many, many ways. And then the drawbacks of dentistry. So made it sound very, very exciting, but there is a heavy kind of um, cost on the front end, which is the amount of education and the amount of years you have to kind of invest in becoming a dentist. And so, generally speaking, it's about 8 years of higher education. And so, the average 4 years to get a bachelor's degree. Although there are some schools that don't require a bachelor's degree, but almost every school actually highly, 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 highly suggests you get a bachelor's degree. And so, and then there's the additional 4 years of dental school education. I believe, with the exception of University of the Pacific, I want to say, which is 3 years. But I believe that's really the only school that doesn't do a 4 year program. And so, obviously, with that comes higher education costs with all those years, and so significant student debt, like we touched upon at the beginning of this presentation. So me and Arij were very conscious of that and wanted to really reduce that burden on ourselves, and especially being as Sudani and Muslims specifically. Loans come with interest, and that's something that we think about and are very aware of. There's also physical strain, and so a lot of dentists you'll see are open 4 days a week instead of 5, and sometimes that's because they believe they just need that extra day to kind of unwind, and because it is very physically taxing. It can be physically taxing, especially if you're not practicing good ergonomics, ergonomics just means how you're kind of orienting your body in space as you're working on patients. And so, as you can imagine, some patients then may just be a little bit harder to deal with, not in terms of their personalities, but in terms of how you're managing the treatment. You may have to bend over a little bit more. You may have to flex your neck. You may have to extend a certain part of your body that you didn't know you had to extend through this treatment. And so it can be a little bit physically taxing. And then there is an emotional stress for sure, especially the more empathetic you are, I want to say, as a person, the harder it is to be a healthcare provider in general. You really kind of absorb a lot of the stress and the pain of your patients. And so that is something that, it's very prudent and important that you learn how to manage if you're going to be in the dental career. And then there can be long hours depending on how you work. Again, there's flexibility in it and how you set up your practice. But like the slide says, especially if you're a practice owner, the front cost of setting up your practice sometimes can be a little bit intense. And so that's something also to be conscious of. High degree of responsibility to your patients. Always, when you're going to healthcare and you're caring for people and their health, don't just look at it as an opportunity to make money. You are taking care of people. These are people with families and with a full life that you don't know anything about, and so treat them with respect, and that comes with a high responsibility. And so, and then obviously the financial concerns is another thing, right? These people also have burdens that they're dealing with financially, and dental treatment, unfortunately, is very expensive and can be very expensive. And so it's something to be conscious of as you're kind of making treatment plans for patients while considering kind of your own income as well, because a lot of times the dental career is very commission based. And so the amount of work and treatment that you do is really how you eat. And so trying to find a healthy balance of, selling treatment that is needed without overselling treatment that isn't needed for your own sake. And it becomes a moral and ethical issue. And so that's another thing that can be a little hard on people as well.
Another thing I want to add that I particularly find a challenge is that dentistry can be very unpredictable, which can be frustrating for you if you like predictability, if you're a person who likes black and white. And of course, like, your patients also want to know, like, straight answers. They're asking you, like, sometimes you just don't know if you can save a tooth. It's a lot of like, We can open it up and then we'll see. You may need a crown and a buildup. That could be a couple grants, or you might need a root canal and a core buildup and a crown. Or we might find out that we can't take, save this tooth and we got to extract it. So that's not uncommon in dentistry. Which can be frustrating, right? Because especially like Mazen said, like you're dealing with people who have financial obligations and they want to know how much this is going to cost them. And sometimes the answer is you don't know. We'll find out. So it can be a little bit of a challenge, but for the most part, I will say dentistry is it's stressful, but it's highly rewarding. Especially when you get that patient who's in pain and they can't sleep, they can't eat, and you're able to relieve them of that pain. That means the world to them, but also to you. Kind of going back a little bit to the benefit and having that immediate impact that you can get from dentistry. So a lot of it is really understanding who you are, what kind of things you like in a profession, understanding your personality, and seeing if you are a good fit for dentistry. Because not everybody, wants to be a dentist, and not everybody's a good fit for dentistry, and vice versa. So my biggest advice would be like really take the time to learn about the profession, which you're here, so that's a good thing already. You're learning more about it. But really do go shadow, ask the dentist that you're shadowing, what's their favorite part about dentistry? What are the things they don't like? That way you can get a really good picture of, if this is a good fit for you.
Okay, so like I said before, most dentists are general dentists. And so when you graduate, you don't need to go into a residency, you don't need to pursue any further training. Although I will say, caveat to this is that all healthcare providers know that the learning never stops, even after graduation. And so you're now equipped with the basics to go and help people and treat them in your specific field, but there will always be experiences that introduce you to nuances in the profession, and kind of new issues that you never knew were even possible. And so just a primary example of that, yesterday I had a patient who came into the clinic with essentially a piece of dead bone in their mouth. Not to get too graphic for the people that get a little bit squeamish, but if you're here watching this, I'm sure you probably don't have a problem with this, but and it was, in a particular place where you want to be careful and you want to kind of avoid giving treatment unless you're kind of have more specialty training, but at the same time the patient was in pain, and so it's like Ari said, sometimes you can't really do much for them at that point, and honestly the best thing to do for them is to refer them to a specialist, but in the meanwhile they're in pain, and so you're something that you feel bad about, and you can only just kind of mitigate their pain as best as you can until they're able to see that specialist. And so after that procedure I went and learned more about how to better treat patients if I don't know how to do what I need to do in this particular circumstance. And so the learning never stops, but most general dentists, they graduate and they can just kind of learn by experience as they're in practice. Some of the specialties, or these are all the specialties in dentistry that are listed below, including oral surgery, which is by far has the most extensive training out of all the residencies or all the specialties. But as you can see, the front end cost does produce a very significant increase in your salary, and so it does. The training is well worth it if money is the thing that you're chasing. Again, I wouldn't recommend that because 4 to 6 years is very tough. If money is all you want to pursue, you'll find very quickly it's not worth it. But oral surgery is definitely a very, very, very interesting field of dentistry. And I want to say most people, or not most people, I'm sorry, but a lot of people who go into dentistry are interested in pursuing oral surgery. How much they want to pursue it after they're done with dental school is a different question, but that is definitely something that you see. Orthodontics is also another popular specialty of dentistry, and orthodontics involves the movement of teeth in space to produce not only pretty smiles, but also healthy and functional smiles. And so orthodontics a lot of times actually also work with oral surgeons to have patients ready for surgery if they have a severe underbite. Underbite is when you have your lower jaw extending past your upper jaw. And for those patients, eating can be very, very difficult. And so,
If we
oh, sorry, I
study
thought somebody was asking.
all right, go ahead, sorry.
No worries. And yeah, so orthodontics can also be very fulfilling outside of just, producing beautiful smiles. Endodontist is another specialty of dentistry that involves acute care. And so they primarily focus on root canals. So if you have a tooth that has a deep cavity that has reached the nerve of your tooth, which is in the middle of your tooth, at that point, a root canal is indicated if the tooth is savable or restorable is what we call it. So if there's enough healthy tooth structure to where we can save the tooth, essentially, a root canal would be indicated in that case. And so, and that involves 2 to 3 years of residency. Pediatric dentists, generally speaking, are dentists that focus on patients that are anywhere between birth to 18 years old. Their specialties makes them very well equipped to kind of handle patients with, I guess you can say, behavioral kind of issues. And so these dentists tend to be very upbeat and very high energy, and very good with younger patients in that demographic. Periodontists are another subspecialty of dentistry that is a surgical specialty. And so they focus on the gums and bones around your teeth. And so they are really focused on saving your teeth if you have gum disease or if you have bone disease. And so that bony housing around your tooth, if it's reduced, they're focused on kind of keeping that environment clean so you don't progress in those types of diseases. Oral radiologist. I will say I'm not as familiar with the day-to-day of an oral radiologist, but generally speaking, they're dental specialists who have spent 2 to 3 years of residency, postgraduate training, in diagnosing and assessing radiographs and images that could help in detection of pathology or anything like that. Prosthodontists are specialists who are involved in replacing teeth or in fixing very damaged teeth. They have kind of more specialty training when it comes to occlusion or how your teeth are biting together, along with orthodontists as well. But generally speaking, prosthodontists really focus on replacing teeth with prosthetics, whether that's crowns, dentures, implants, things like that. And oral pathologists focus more on kind of the disease that's involved in the oral cavity. And so a lot of their work has to do with managing biopsies that are sent to them, making sure that there's no significant disease that needs to be remedied right away, God forbid, cancer or anything like that. And then public health specialists are specialists who kind of deal more with subsets of the general population that may not have the best access to care, essentially. And so they're kind of well equipped to be in those areas and to kind of mitigate any discrepancies or any reduction of care kind of in those areas. And so we kind of spoke about this a little bit earlier, but general dentists, obviously, our bread and butter is fillings, cleaning, things of that sort. But like Arish mentioned earlier, a big thing for us is dental education for patients to be able to take care of their teeth at home, other treatment modalities. And this is one thing I probably could have mentioned in the last slide. General dentists are more or less equipped in a lot of the specialty fields. And so we have training in a lot of what the subspecialties do. But the training is not as extensive as the specialty training that you would get. And so you'll find some dentists that just with experience in their practice, they may like prosthetics more. And so they'll do a lot of denture work or they'll do a lot of crown work. You'll find patients that maybe like kids a little bit more. And so they'll work with a lot of younger patients. You'll find patients or dentists that like root canals more. And so they'll perform more of that or extractions more. And so they'll do more of that. And so it's very flexible in terms of what you can do, but overall, just managing your oral cavity in terms of acute pain to get you out of pain, and prevention in terms of not having you get to that point where you need acute care in the first place. And Arish will probably touch on that a little bit more.
Yeah, so I would say like the general dentist, it's kind of analogous to your primary care physician that you would go to
Mhm.
for regular checkups. They know pretty much enough about everything, but if there is a, situation where they need maybe a specialist sort of experience, and they would refer you out either to like an ENT or, if you have it just depends on like what your needs are. So the Mazen touched on it. The general dentist, we have to know a little bit of everything, but we also need to know when things are kind of our side of our scope of experience. So, for instance, a lot of people don't get too much experience with placing implants in school. So it'd be kind of crazy for you to go straight out of, school and start placing implants on people. You'd definitely be in front of the dental board. So um but you can take CE courses and you can learn more about different procedures that you're interested in. If you want to learn more implants, you can take continuing education courses on that. And once you feel like you have an experience and you have the certification, then you can start placing those or doing those type of procedures on your patients. Um, but it's also the nice thing of it being a general dentist, if you like one procedure more than the other, then you can sort of limit your practice to that. I know a general dentist who's not an endodontist, but she loves root canals and that's all she does, which I think is, it's not common, but she limits her entire practice just doing root canals. There are people who love more removable prosthetics. So that's your dentures, your partials. I personally don't like doing removable prosthetics, so I probably don't see myself doing too much of it. But of course, like I still need to know enough, and if I have a patient who needs it, then you got to be willing to do it. Um, but again, the nice thing about being a general dentist is you do a variety of procedures, which I think it's kind of nice compared to a specialist who does the same procedures kind of every day. As a general dentist, you might have an extraction in the morning, and then you may do a denture appointment, and then you may do maybe a root canal on a front tooth, and then you may be doing, just an exam. So there's a lot of diversity of procedures that you can kind of see during the day. So I would say that's a big advantage of being a general dentist. All right. So now that we talked about the different specialties and what dentists do, we can talk a little bit about how you become a dentist. And Mazen already touched on this a little bit at the beginning. So for most schools, you do need to have at least a bachelor's degree. It doesn't really matter what that undergraduate degree is in. Ideally, you want to have something that gives you a good background in science. But again, it's not required. What is required is there's a list of courses called prerequisite classes. Those are your courses in biology, chemistry, physics that every person who's applying to dental school has to take. And you have to do well in those courses. And the reason you have to take these classes and do well is they want to see that you have a good science foundation. Can you withstand the rigor of dental school, essentially? But again, I my advice would be choose a major that you're genuinely interested in. There are a lot of people who do biology majors, but don't actually like biology. And I can't imagine doing a whole degree on something you're not interested in. And then when you come to the interview and they ask you, why did you major in biology? This is nothing against biology, but you have to be passionate about whatever major you chose. So you're not looking like a deer in a headlight, right? So my major was in nutrition. It was public health because I love public health and I still do. And I was able to speak about that very comfortably when I was interviewing. There's one of the underclassmen at our school, she majored in English. She loved reading and she was good at it and she still reads. And that's what she chose to major in, and that set her apart. So do something that sets you apart, but make sure you're genuinely interested in it and make sure you're good at it would be the advice I would give you. Like I said, the majority will major in biology, but you don't necessarily have to. You don't want to be that cookie cutter applicant. After you get your bachelor's degree, you do have to take the DAT. So the dental admission test is required for you to apply to any dental school. This is kind of the equivalent of the MCATs for medical students. You take it, you want to make sure you do really well on it, and we'll go into like some of the resources that are out there that can help you. And Maz and I can talk about which ones we used and which ones we thought were really good. But you want to make sure you do really well on the DAT. If you don't, it's okay. I know a lot of people who retake the DAT and they get into dental school just fine. And then after you do the DAT, you apply to dental school, and all the U.S. accredited schools are part of the same application process. It's called ADSAS. So there's a common application that you apply, and it goes to every school, but there's also what they call a secondary application. So sometimes a school will have a secondary application because they want to get to know you through other sort of essay questions. So some schools will require it. Other schools may not require, but still expect you to pay a secondary application fee just to make money off of you, if I'm being honest. So that is sort of a little bit about what that application process looks like. Then once you successfully get into dental school, inshallah, you go to dental school for 4 years. Most programs are 4 years, except the one that Mazen mentioned earlier, the school in the Pacific or something like that. They're a 3-year program, but that's very rare. And that's out in California. And then after you finish your 4 years of dental school, you either get a DDS or a DMD. I'm a DMD. Were you a DDS or a DMD, Mazen?
Yeah, we were DDS, but I literally doesn't make any difference.
It doesn't make any. That's the point I'm trying to make. It really doesn't matter. It's still a degree from a dental school that's accredited, and it's just a difference in philosophy. That's all it is. So it doesn't really matter if it's a DMD or a DDS. And then within dental school, you do have to pass the IMBDE. So that's a written exam that every dental student has to take, and they have to pass. It's the board exams. So we took it our 3rd year of dental school. Once you're done with the written exam, you also have to pass state licensure exams. And they're basically testing, your skills in different fields. So periodontology, endodontics, prosthodontics, and restorative dentistry. So we have to know how to do fillings. Essentially, we have to know how to do a bridge prep design. We have to know how to clean teeth. We need to know how to do a root canal. And after COVID, it used to be that these licensing exams had to be on live patients. I was lucky. I don't know if it was similar to you or similar for you, Mazen, but for us, it had changed after COVID, where it became mannequin head. So all our exams were taken on basically a fake head, which was good. So it's standardized the test for everybody. Most schools encourage you to do your licensing exams while you're in dental school, but I don't think it is required. So I know that sometimes people will wait after they graduate to do all their licensing exams, but at least at ECU, we split it up. We did some of them our 3rd year, and then we did the remaining our 4th year. So all of us are kind of done with all of our board exams and our licensing exams, and then you just kind of apply for the state licensure. And then if you want to get specialized training, then you would go back for 2 to 6 additional years of specialty training. And I think we touched on that in great detail earlier. So a little bit about the timeline. Remember, this is the ideal timeline to apply to dental school. This is for someone who's going straight from undergrad to dental school, which was not my experience. I definitely took a year off, and Mazen said he did a master's program. So we both took gap years off. But if you're someone who's going straight from undergrad to dental school, ideally by that spring semester of your junior year, you're supposed to be studying for the DAT. And you're supposed to be putting together your application. So you're supposed to be asking your recommenders for letters of recommendations. You're supposed to be putting together your personal statement. And when that application opens up in May, everything has to kind of be together, and then for you to start submitting applications. So that summer after your junior year is when you're supposed to be submitting your applications and doing your secondary applications as well. And then most people interview as early as September of that year. So, and then the thing about dental school and medical school is the same way. It's a rolling basis, and that period when you're applying could take up to a year. So from September to April, you could be doing school interviews, and then offers are made as early as December. So I think yesterday actually was when the new batch found out if they got into dental school yesterday. So December is usually when people find out if they got in. But it doesn't mean that you find out from all schools. So sometimes if you had a later interview, you'll find out later. So for me, I found out about a couple of schools on December 15th, whether I got in or not. And then I actually didn't find out from ECU that early. I think it wasn't until maybe, I can't remember, maybe February or March that I found out from ECU that they accepted me. So, and that can be a little tricky because you may get acceptances from school that you may not want early, but the one that you want may have not responded to you. And you kind of have to play a little game and, you know, you have to reserve your spot just in case. But at the same time, remember that costs you money. For you to reserve a spot at a dental school, you actually have to pay them a deposit and you have to be willing to forfeit it later if you get accepted into the school that you want to. And then dental school begins July the following year. Like I said, just if you don't hear from the school that you're interested in during that first time that they're letting people know, don't be discouraged. Like I said, I got an offer much later for the school that I wanted compared to my classmates, but there's somebody that literally found out maybe a week before school started that they've been accepted. So it really is a rolling basis. Kind of going back to what I was saying about the gap year, it's more common now actually to take a year off or multiple years off than to go straight into dental school, just because the application process can take a long while. I mean, I can't imagine you taking like your junior year courses, which is kind of like the main courses for your major at that point, and then also trying to put together a really good personal statement, and then also putting good letters of recommendations, and then also applying. So it can be a lot. I'm not saying it's not possible because obviously it's been done before, but you just want to make sure you do what's best for you. So if it means taking a couple years off, that's okay. As long as you have a plan of what you're going to do during that year, whether it's you need to be practiced for the DAT, or you're just applying, or you're doing volunteer hours. So it's okay if it takes you longer than the person who goes straight out of dental school. I don't know if you wanted to add anything, Nazim, to that.
Yeah, it's been quite a while since I've gone through this process, but I think our each has comprehensively kind of gone through it. I think the biggest thing to echo from what she said is, don't be discouraged. Sometimes it does take some time for the acceptance to come in, and don't think that you have to take this traditional route of, finishing undergrad, going straight to dental school. I mean, it's great if that's your goal and it happens for you, but not to turn this into a therapy session, but your worth is not defined by your career or your job or the path that you take to get to where you want to get. It's that really has nothing to do with you at all. Sometimes it's just a crapshoot of a process, and you may not get accepted just because no reason, honestly. There may be just everybody's a good applicant for whatever reason, and they just kind of have to randomly pick, and that's become the case actually, surprisingly, even more because applications for dental school have increased, and so it's just take your time with it, be yourself, be genuine. I think the biggest thing really that shines through in the admissions process for the admissions officers at dental schools is someone who's sincere and genuinely themselves, and really cares about people and really cares about helping people, because at the end of the day, they have to create a class that's going to get along with each other. And so if they see that you're somebody who's friendly and somebody who's willing to be collaborative and work with others and not be overly competitive, then I think that says a lot. Because if they invite you to the interview, that already says that they like who you are on paper. And so as important it is to work on all these things on paper, it's I would say even more important to work on who you are. And like Ari said earlier, it's really define if this is the path for you. I think this is a great path. I would always recommend dentistry, like I said, to anybody, but really make sure that this is what you want to go into. And if that's the case, and you have kind of this idea of wanting to help people, then you will do just fine.
Thank you for that. All right, so how do you become a competitive applicant? So I'm just going to give you a little bit of statistics about and these are from 2020, so kind of take them with a grain of salt. So the average GPA for admitted students in 2020 was a 3.6 GPA. So and I just want to take a moment and, ask, what if your GPA is not a 3.6? Does that mean you don't apply? No, it doesn't mean that you don't apply. I know people who have gone to dental school with, a GPA that's lower than that. But you also have to be honest with yourself. If you have a GPA that's lower than a 3.0, then maybe you're not the most competitive applicant yet. That doesn't mean you can't become a competitive applicant. And it's not too late for you. There are programs that kind of can help you get to where you need to be. And perhaps that could be a post-bac program. So, and that usually targets people who, didn't do real well on the prerequisite classes and want a second chance so that they can prove that, hey, I maybe had something going on. In my life when I was in undergrad, and I just didn't perform in these prerequisite courses to, the way that I wanted to. So in a sense, it gives you a second chance to retake those courses and, do better, and then show the admissions committee that you can improve and that you can withstand the rigor of dental school. I know UNCG has a really good and reputable post-bac program that I know a lot of my classmates have done and help them get to where they need to be. And I think it usually takes about a year and a half. The other route you can do is a master's program as well. And a master's program also allows you kind of to have a clean slate. It's not that they don't take, look at your GPA from undergrad, but it does give you an opportunity to demonstrate that you can take graduate level courses and do well. And I think that goes a long way when you're applying to dental school as well. And maybe you want to touch a little bit about the master's program, Mazen, since you did it.
Hmm. Yeah, and I mean, that's actually exactly why I did my master's program. And so, my GPA definitely wasn't the most competitive, but it offered me the opportunity to show what I knew, which is I could perform well in dental school. And so, it's really, again, just statistics on paper. And if you can, again, it doesn't define you, but it does show that you are diligent in your studies, and that's what they want to see. And so, the master's program that I did was at NC State, and so for North Carolina students, they're more likely to look favorably on your application because they're going to assume that's the track you want to take is to stay in North Carolina. And given the high need in North Carolina, that's something that they would prefer anyway. And so the master's program that I did was specifically focused on physiology. It was a master of physiology, and so it was a great program. The faculty there were very focused and really did their part to try to make sure that everybody got to the goal that they wanted to achieve, and with really good results. And so I personally enjoyed the program. It helped me kind of reorient and gave me time also to figure out the whole application thing. And so it's something that I would recommend, either that or the post-bac program, because it really will give you time to solidify if dentistry is the thing for you also. And so or healthcare in general if you want to apply to med school, but I know this is targeted to dental school. And so, yeah, I definitely recommend it if you are in undergrad and you're coming up on your graduation and you feel like your stats might not be the highest, like I already said, it's still worth applying if you think that you're ready to take a shot at it. Definitely do apply, but obviously there is a cost associated with the application, like we mentioned earlier, and so if you feel like it would be a better investment to go through the master's program and then apply to kind of better your chances so you can have more of a better chance of a one shot type of situation at it, then I would recommend it.
Yeah, and I just wanted to touch a little bit on the part you said about the financial aspect of the master's program. And that's kind of one of the deciding factors that people consider when they're choosing between a post-bac program and a master's program. So with a post-bac program, correct me if I'm wrong, but you can get financial aid for that. And and it is cheaper than doing a master's program. So just something to keep in mind when you're deciding between the two. All right, so now moving on to the DAT. So the average DAT score for admitted students was a 20. And just keep in mind that it will vary based on schools. So some schools, 20 is is an average for the students, all those students who have been admitted to a dental school that year. So it doesn't mean that a 20 will get you anywhere. It may give you, I think it's a solid score that could definitely get you into some schools, but some schools may have maybe a more competitive DAT score. So if you're looking at Harvard, maybe a 20 might not be the most competitive. That doesn't mean you can't get into Harvard with a 20, but just some things to consider is that it can vary based on schools. And some schools are truly very holistic. And that's kind of been in my experience where I didn't really fall within the average DAT score that they had, but I got an admission and I think maybe they've considered other parts of my application. But also just want to drive home that academics is really, really important when you're applying to dental school. And sometimes if your DAT score is not great, but you have a good GPA, the good GPA can kind of help balance that out and vice versa. But just know that I would say it's the number one important factor that admissions consider when you are applying. It doesn't mean it's the only thing, but it is the most important thing, in my opinion, that they consider. And then the other thing is that they really do want to see that you have some sort of, not some sort of, but actually extensive history of volunteer and community service experiences. So a competitive applicant may have anything from 250 to 300 plus hours of volunteer work. And that's throughout your undergrad years, or if you take a couple years out. So it's really important to keep track of those hours. And the reason they do that, and this doesn't just apply to dental school, but this applies, I think, to all healthcare professional schools. It's very hard for you to convince someone that you like to help people when you haven't really demonstrated a track record of helping people in the community. So that's something that they don't take lightly, is they want to see that you're really out there in the community. You're not just talking the talk, but you're walking the walk, as they say. So, and those volunteer hours don't have, you're not limited to one thing. They can be anything from, volunteering at homeless shelter to maybe volunteering at a dental clinic. It really doesn't matter where you get those volunteer hours. But my recommendation would be is find an organization that a volunteer student organization or even a nonprofit and stick with them. And I say that because you want to have a lot of hours, but I think in this case, quality over quantity definitely applies because over the years, you'll show that you've stuck to the same community. And then it also, as an undergrad, like if you're joining one organization as a freshman and you're sticking with them till senior year, that allows you an opportunity for you to grow in leadership opportunities within that organization. And that way you're kind of two birds, one stone kind of situation, which was what I did. I joined a nonprofit my freshman year and I stayed with them all 4 years. And they had nothing to do with dentistry. So just driving the point home that it really doesn't have to do with the profession that you're trying to get into. Mine had to do more with literacy and I was tutoring kids, but that's something I genuinely was interested in, generally something that I wanted to do. So just saying that it really doesn't have to be all volunteer work related to dental field. And actually, those are the things that will set you apart when it comes to interviewing. The other thing is shadowing experience. So as an applicant, you're expected to have shadowing experience. Most schools recommend anything from 100 to 150 hours. I've heard people say 200 plus hours, but in all honesty, there comes a point when you're shadowing where you're not really learning anymore. You're not going to learn until you start doing the work yourself, which they're not going to allow. So kind of, I would aim for 100 to 150. I'm going to be honest, I felt short of that. I had maybe, I would say 60 to 70 hours, but keep in mind that I also applied during COVID year. So I used COVID year to my advantage and said that, I couldn't shadow anymore, things were closed down, but that's not going to work because we're post COVID now. So I would aim for at least 100 to 150 hours of volunteering or shadowing, sorry. And that's also important because one of your recommendation letters has to be written by a dentist. So, the more you shadow them, the more you can kind of develop that relationship. And so when it comes time to apply, you have somebody who can write you a dentist or a dentist recommendation letter. Um, I will also recommend shadowing a general dentist, but also try to shadow other specialties. Even if you think, you're set on being an orthodontist, you want to be an orthodontist. I wouldn't just shadow an orthodontist. I would still shadow different specialties and a general dentist, and I would almost steer away from saying that you're set on being an orthodontist because I mean, how many people do we know that, they want to be a certain specialty and they get into dental school and they change their mind? That maybe they decide they want to be a general dentist, or maybe they decide they want to do another specialty. So they just want to know that you're someone who wants to keep an open mind. Something about ECU particularly. So look into the mission. ECU is their mission is to produce more general dentists, just because they want you to go out into rural areas and serve the community, because there's a lot of shortage of general dentists or dentists, period, in certain rural areas of North Carolina. So for someone who's applying to ECU, I wouldn't really recommend that you state that you want to do a certain specialty, even if you know you want to do it, because that's kind of not their mission. If you're applying to UNC Chapel Hill, by all means, they have all the specialties of dentistry there. So just know which schools you're applying to, what their mission is, and so you don't put yourself in a situation where you're kind of at a disadvantage because they're thinking that you're not keeping an open mind. The other thing is, and I kind of highlighted this a little bit, is you need strong letters of recommendations when you're applying to dental school. One does have to be from a dentist. And then if your school offers a committee letter, then some schools will require you to have a committee letter from the school that you got your undergraduate degree from. When I was at UNC, they didn't have a committee letter, so I had to get letters from my biology professor, my chemistry professor, if I remember, and then I think there was one more. But again, it's very important that you do your research and you look into the schools that you're applying to see if they have any sort of requirements when it comes to those letters, because I think for ECU it specifically had to be a chemistry professor and a biology professor. Some other schools don't have any requirements so long as it's a science, course. And so I would just kind of do your due diligence and make sure that you're aware of what those requirements are. And then of course, you can't forget about personal statement. This is literally your time to shine before they get to know you in real life. So before the interview, this is kind of like the pre-interview. Think of it that way. In my opinion, it is the most important part of the application. And we'll get into a little bit about how to create a personal statement that's successful and, makes you shine. And then you also want to be a well-rounded applicant. I can't emphasize that enough. The cookie cutter will be your biology major. I know I keep giving the biology majors a lot of heat here, but you don't want to be biology major who is a biology major just because you think you're going to be a biology major, and then you are only a dental assistant and you've only done experiences that are related to dentistry. It's very important that they see that what your interests are outside of dentistry, because I mean, we're whole beings. We don't, dentistry is not all of you, like Mazen alluded to earlier. It's something that you want to do. So, and then another thing to consider when you're, like I said, do the experience that are genuinely interested to you. And then, when it comes to interviews, it's in my personal experience, those were the things that I've gotten asked about the most, the things that, made me stand out. And when you really think about it, when you're a well-rounded applicant who has a diverse variety of like experiences, that in a way makes you a better provider because you can relate to your patients on a different level. No patient wants to sit there and just talk about dentistry. So they want it, you got to be more human. You have to have your own interests and experiences that you can kind of relate to your patients with, so they can become more comfortable with you. And then, so here we listed our different extracurricular activities that we did in undergrad, just to give you guys an idea of what our experiences were like. And for me, I I did volunteer at a couple of free dental clinics. I know in North Carolina and maybe some other states too, they have something called Missions of Mercy. So this is a huge initiative where they bring like faculty, from different schools, volunteer dentists, dental students, and they provide free dental care to the community. It really is an amazing mission. And then it rotates in different parts of North Carolina. I know for ECU particularly, like it wasn't stated, but they kind of expect you to have had that experience with the Missions of Mercy Clinic. Some other clinics, there are also free clinics that I volunteer were the Shat Clinic, and that was based out of UNC Chapel Hill. And then the Care Clinic is also another free clinic that runs on certain Wednesdays, I think, of the month. And that's in Durham, led by a professor there. The other thing that I did was like I said, I worked for a nonprofit for 4 years during undergrad, and they focused on just improving the literacy skills of K through 5 students in the Chapel Hill, Carrboro area. And I genuinely enjoyed doing that. And then as I continued to work with them over the years, I got to a chance to like take on different leadership positions and start different initiatives within the organization. The other thing I did was the storytelling project. Again, had nothing to do with dentistry, but something that I just genuinely loved. I remember I took a course at UNC during my first year, and we learned how to tell like folktale stories. And then it became a thing. And then our faculty got like a grant, and he added me to the grant project. And basically, I was translating Sudanese Arabic folktale stories to English, and then we were doing like videos of it and posting on YouTube. Please don't look this up. It's quite embarrassing now that I look at it. But it was fun. I really enjoyed it. It's something that I always asked you about in dental school interviews. The other thing that I did was research. I think research definitely helps a lot when you're applying to dental school. But again, my research was on global health. So I was studying the impact of malnutrition in young Filipino children. And it ended up being like a summer project where I got to visit the Philippines and for 2 years. And it was really a good experience. And then my shadowing experience, I shadowed a general dentist, and I also shadowed my pediatric dentist that I grew up with or grew up going to. So I think that's an easy way for you to also find a shadowing opportunity. Most people, when they're younger, they go to a pediatric dentist. So just, go to their office, be very professional, ask them, like, just introduce yourself, say, I'm interested in dental school. I'd love to shadow you. Would you be open to that? And most people will say yes. The other thing is, when I was abroad in the Philippines, I kind of took advantage of that opportunity to just shadow there. I literally just went to like they have like a mall, and within that mall they had a dental office. So I just went there and introduced myself, and it turned out that the dentist owner was actually someone who trained in California. So ended up being a good experience. So just a little bit of what um, my experience for undergrad. And then Mazen, if you could speak a little bit about yours, that'd be awesome.
Yeah. So I kind of put the three most impressionable experiences that I've had kind of in undergrad. And so Carolina Housing, I worked as a resident advisor for 2 years. So my junior and my senior year. And by far, one of my most favorite experiences in undergrad was being a resident advisor. And so a resident advisor is, for you guys who are undergrad, you probably know this. And for those of you in high school, it's when you essentially sign up to be not an overseer, but essentially just kind of an advisor who lives within the same dorm or the same hall as other students who are living in that specific dorm or hall. And you essentially are kind of the liaison or the middle person between them and kind of the administrative higher ups of housing. And so any concerns that they have would be addressed through you. You also kind of served as a counselor slash therapist for your residence hall residents. And so I think that was probably my favorite part. I think in a different world, I probably would be a counselor or a therapist. I really enjoyed kind of speaking with these different people and seeing what their experiences were and having them open up to me about what it is that their goals were or what their lives were before they came into the hall. And so I think that also just really helped me kind of become more sympathetic and empathetic, uh, because at the end of the day, their well-being was my job for those 2 years, and so I really appreciate that experience a lot. I also had some research experience. I worked in a lab with Dr. Judici, and she was amazing. She took me on and kind of taught me um, a lot of bench lab work. I will say it was probably one of the most boring experiences I've ever had. I learned a lot, but I also learned that bench work is not for me when it comes to research. I probably would have appreciated something more like what Arish did with, um, actual like kind of on the ground interviewing and data collection and public health and things like that. That probably would have been more my speed. Um, but it was still a great experience and I learned a lot from it. And then I worked as a surgical assistant. I was an extern at a place called Triangle Implant Center, and um, this was a multi-practice institution where they took on people who were interested in dental school, and you kind of work with them either as a surgical assistant or an anesthesia assistant. Surgical assistants essentially were assistants in the operating room with these oral surgeons, and so that's when I was introduced to oral surgery, and I fell in love with it. And it was very fast paced, and it was definitely kind of stressful. But the surgeon that I worked with was great, and he really cared a lot about giving back in terms of education to people who were interested in the dental career. Outside of that, my shadowing experience really, I was lucky because my oldest sister is a dentist as well, and so most of my shadowing actually came from her, and so it made things very, very easy for me to kind of set up and do. I will say diversity in terms of your shadowing is definitely important as well, like Arish kind of talked about earlier. But I just kind of banked on the fact that maybe if I did all my hours with my sister, that would have qualified for the hours that they wanted. But I would probably advise against that now that I'm past dental school, knowing how subjective dentistry can be and the things that you learn from different dentists. So I would say definitely try to diversify your experience in terms of who you shadow, different offices you shadow. And an important point that she touched on kind of earlier is don't fixate on one specialty. You're going to dental school, and when you graduate, you're going to be a general dentist. And so there's a very high, I shouldn't say this to discourage you. There is a likelihood that you may not specialize in something. And so you have to be prepared to just be a dentist, whether that's due to a circumstance of potentially not getting accepted your first time around. And by the end of dental school, maybe you don't want to apply. Maybe again, you're now have been delaying gratification for all these years. And maybe now you just want to make a little bit of money, take care of your patients and go home and enjoy time with your family. And so always know that general dentistry might be kind of the end of the road potentially. Not to discourage you, because you can definitely find avenues to do what you want to do. But anecdotally, that's been my experience in terms of seeing a lot of people who want to specialize in the beginning of dental school, and just seeing that by the end of it, they were happy with providing the care that they were providing to their patients, and not wanting to continue beyond that. So I would say make the bulk of your shadowing hours with general dentists, just so you can see what more than likely will be the path that you will take. Again, you'll have plenty of time in dental school to explore specialties. And so I wouldn't worry as much about the specialties as I would about just seeing if general dentistry is the path for you at that point.
All right, so a little bit about the DAT, because I know we got a couple questions about that. It can be a costly, or it is a costly exam. It's $540. It's non-refundable. Yeah, they changed it now. When it used to be when I was applying, I remember I paid the fees, and it used to be that there was like a certain window where if you rescheduled afterward, you forfeit all of your funds, and that ended up being the case for me. So they changed a little bit now, where you still have to pay additional rescheduling fees, but you don't forfeit all of it. So I guess the advice I will give there is sign up for and apply for the DAT when you feel like you're ready. But if you sign up and it's getting closer to the date and you don't feel ready, I think maybe it is worth it to go ahead and pay the rescheduling fee. So that makes, you make sure that you are able to do well the first time. And then I just want you all to be aware that there is a fee waiver that the American Dental Association offers. It pays for 50% of the fees for the exam. They are limited and they're only given to people who are taking the DAT for the first time and have demonstrated financial hardship. I looked it up. The application opens up again in January 1st. So if you're someone who's in that, boat right now where they're getting ready to apply the next cycle, I would highly encourage you to look into that because, 50% of the DAT fee can go a long way, especially when you still have to factor in fees for your applications and secondary applications and then traveling for interviews. So it can all add up and be costly. So just taking advantage of this opportunities can really help you. When it comes to studying the DAT, there's a lot of resources out there, but the most popular one is the DAT Bootcamp. And that is the one that I've used. And the price that they give is $519 for a 3-month subscription. The another one that a lot of people use is a DAT Booster. And people like that one for the perceptual ability test. So part of the DAT is you have the sciences, you have reading comprehension. And I think math, if I'm not mistaken, is part of it. But there's a part of it that's a lot of people are not used to, and it's the perceptual ability. So they're basically, um, it's something that you have to practice early for, and they're trying to test your ability to, one example I will give is tell the difference between a 47-degree and maybe a 50-degree angle. It's trying to see is exactly what it's called, your perceptual ability, because it's very important when you get to dental school that you develop that skill. Um, so people like the DAT booster for that aspect of the exam and also the biology and the chemistry. That one does cost a little bit less with $309 for 3-month subscription. Some of the other ones that are out there is DAT Destroyer. The ADA, I believe, gives some free practice exams, and then there's Chad videos, and there's the Kaplan courses. I don't necessarily recommend the Kaplan courses. I think they're a couple $1,000s, and the people who have taken them, I don't think they've said it was that helpful. Like I said, I used the DAT boot camp, and I remember during that time during COVID, I wasn't working, like all these costs were like adding up, and my parents were helping fund some of these applications, and it was very tight when it comes to like finding a resource for DAT bootcamp. So what ended up happening for me, alhamdulillah, is I actually had a friend who purchased DAT bootcamp, and then she was nice enough to just kind of let me use her login, and that made all the difference for me. So I don't know if they'll flag it now, but maybe you can find a friend and you guys can split the cost. I probably shouldn't say that since it's recorded, but
It's like Netflix.
yeah,
They'll
just
figure out if it's a different Wi-Fi.
oh, okay. So maybe caught on.
No, I'm just kidding. I have no idea. Hopefully not.
Hopefully not. That'd be crazy because they make a lot of money. But if if they haven't caught on, I definitely recommend find a friend or two, split the cost, and use DAT Bootcamp, and then just kind of coordinate between yourselves which practice exams you're going to take. Did you use DAT Bootcamp, Mazen?
I did. I did use DAT boot camp. I believe it was much cheaper at the
Okay.
time when I was using it because DAT boot camp has really kind of expanded its functions a lot. I believe now they have like med school like preparation stuff. They have INDDE courses, and so they really ramped up kind of their user interface and just a lot of things in their website. So I think for that reason it's become more expensive. But at the time it was a little bit cheaper for me. I mostly used DAT Bootcamp and DAT Destroyer. I was actually given the book by a friend. I was given DAT Destroyer, specifically bio, the biology section, because that was where a lot of the breadth of kind of information was coming from in the science section, at least personally for me, because I was a chemistry major in undergrad. So that helped a lot with the chem sections. But for biology, there's just at first it can look like a lot of information, but really if you kind of tackle it little by little and do a lot of practice questions, you'll find that a lot of the stuff sticks. And a lot of times you'll find these similar questions from DAT Destroyer on the test itself. And at least that was my experience. But I recommend DAT Bootcamp from my experience, and also maybe the DAT Destroyer bio is what I use. But obviously, it's been some time since I've taken the test, and a lot of these resources have changed, and so it's from what I remember, it was a good resource.
I wish I knew DAT destroyer was good for chemistry because that would have helped me a lot. I did not
Yeah, yeah.
at all. It was my lowest score. I'm gonna be honest. So for the DAT, my overall score was fine. It was a solid 20, but then I had a sub score of 15 in organic chemistry, which if you're taking the DAT or you know anything about the DAT, that's like a red flag right there. It's below the average, and it's something that I've gotten asked about when I was interviewing, and I just kind of said like organic chemistry is not my strength, and I just did my best, and I guess that worked. But it definitely is something that I wish I used. But another thing I want to say about that red flag I had, and if you ever find, and I hope you don't, if you find yourself in a situation where you have scores that are below the average, like which was my case in organic chemistry, I would advise you to email the admissions for different schools, which is what I did, because some of them actually have cutoff scores. So some of them won't even look at your application if it's below a certain score, even if it is a sub score. Even if your overall is fine, but you have a sub score that's below the average, sometimes they have a cutoff. So it's better that you email them and you know that information before you give your money. And that's money that could have went to a different application. So I would, and it doesn't mean it's the end of the world. I remember ECU emailed me and because I was like, you know what, I'm happy with my score. Whatever school takes me, I'm just going to go with it, but I'm not retaking that test. I absolutely could not sit there and retake the DAT. I didn't have it in me mentally, emotionally, financially at all. So when they emailed me and they were like, your application is under review, and we just wanted to know if you had planned on taking the DAT again. And I remember I asked one of my mentors, and she was like, if you tell them that you're retaking the DAT, they might not look at your application anymore, and they'll put it aside, which can push you even further in the cycle. So I told them I wasn't going to retake the DAT. So that means they, would review my application and make a decision, but they didn't let me know. And maybe that was one of the reasons that I got maybe a late offer from ECU. But like I said, you know yourself. If feel like your score will make you more it'll make you more competitive if you retake it, then by all means. But it's definitely a case by case basis. I'm more than happy if you find yourself in that situation, let me know. More than happy to offer advice. But I think admissions committees and admission office will be a great way for you to also seek that information. All right, personal statements. Personal statements can be overwhelming because it's kind of you telling your story, but at the same time, people kind of find themselves falling in the trap of telling too many stories, or they're telling stories that are not about themselves. So it's really important to know that when you're writing this ultimately has to be about you. So yeah, your motivation may be, maybe a family member who lost their teeth very early on, and that maybe motivated you to be a dentist, but in a way you have to spin it so that it still comes back to you. So something to be mindful of. The other thing is that, like I said, sometimes people put too many stories within their personal statement, and sometimes those stories don't really tie in well together. So while it is a personal statement, there's still structure to it, right? So you still have to have a theme within the personal statement. Another thing that people fall into is, and it's not saying this, and I kind of, this happened to me too. Sometimes we get so caught up in, the lack of access of care, right? That's a big motivating factor for a lot of people in the industry is the lack of access of care. to dental care, at least, whether we've seen it in our communities, where we've experienced it on a personal level. But when you're writing that personal statement, you have to be careful not to have a negative tone where you're criticizing the field or you're criticizing the system. Even though you might, have a very negative view of it, but at the end of the day, these are, you're writing these personal statements, they're being read by people in the field. So what I would say is rather than, stating statistics on how the dental field doesn't provide care to everybody and how you've been impacted, take a step back and really think about what the solutions or what you think the solutions are to that. So, and that's how you kind of have a positive spin on it, is you offer solutions to it and you talk a little bit about your role or the role you will play in addressing those disparities and those inequities in health. The other thing is, like I said, it's not an essay, so you don't underestimate the value of telling a story within your personal statement. It's very easy to put a statistic in there, but it's a lot more impactful if you actually tell a story that has the same message, but it just sticks better when somebody is reading it. So I'll kind of give an example of that. So, and to kind of go back to my personal statement and just pull up an example. So you could say there's a lack of diversity within the dental profession. This lack of representation significantly affects the quality of care that patients from different backgrounds receive. True. Or you could say, and this I just pull this from my personal statement. As I shadowed Dr. X, a pediatric dentist, I recall walking into a patient room and instantly noticing a brown-skinned girl with 2 braids lying down. She was clenching her fist so tight you could see her bulging veins. When I shifted my eyes to the corner of the room, I locked eyes with her anxious mother, whose features were too familiar to not have come from Sudanese origin. I greeted her with salam, and her face instantly lit up. I spent the next moments interpreting and creating an avenue for communication between the Arabic-speaking family and the dentist, translating medical information and light-hearted jokes, witnessing how the elimination of the language barrier created an opportunity for building trust between the patient and the dentist, and ultimately subsided the tension in the room, made me reflect on the importance of representation in the dental field. So this is just an example of how you can say the same thing, but in 2 different ways. One is a lot more impactful because you're telling a story. And it also shows your role within how you being in the dental field is going to fix that lack of representation. Before I move on, did you have anything to add, Mazen?
No, that was a beautifully represented example. I like that a lot.
Thank you. All right, now the interviews. So like Mazen said, once you get an interview from a school, that means they already like you. They just want to see you in person. They want to be able to see, put a face to the name, get to know your personality, see how you will fit within the class that they're creating, essentially. A couple of ways that you can prepare for the interview is make sure you look at the school, look up everything you can about them, learn their mission statement. Are they a school that's focused on research and, advancing dental research around the world and, making sure they produce specialties? Or are they more interested in producing primary general practitioners for the public and for people to go into underserved areas? So these are 2 different missions. You want to make sure you're very well aware of the mission of the different schools. So that when you're going there, you're not talking about X, but they're really focused on Y. The other thing is you can a lot of schools will publish their research online. So you can go online, look at some of the themes they have in the literature, what aspects of research they focus on, if any. You definitely don't want to be generic. So I know it's kind of cliche to say, but you got to be you. There's no one in the world like you. You have to be your most authentic self, right? So just be yourself. Make sure, people can really tell when you're speaking from the heart and you're being genuine. So that also applies to when you're going to interviews. Also reread your application. Sometimes it's been months since you first submitted the application to when you're finally interviewing. And so sometimes, and it's a lot, you can forget certain aspects of the application, but make sure you print it out, you read over it, you know what you put on there, your experiences, your personal statement, be aware of your strengths and weaknesses. So my weakness would be I was well aware walking into that interview that I could be asked about my DAT score. So, and just, make sure you're prepared to address that. The other thing is I know a lot of schools will offer, not the dental school, but like where you go for undergrad will offer opportunities for you to do mock interviews. All outside of their like I think is, the Office of Career Services, every school has some sort of version of that. So take advantage of the opportunities they offer you and do mock interviews. You can do mock interviews with your mentors. You can do mock interviews with faculty, friends. So just definitely practice ahead of time. And then on the day of interview, you want to go in very confident, dress professionally. You have to be professional the whole time. So the interview doesn't really start when you're, sitting in a chair being interviewed. It starts the moment you walk into that building. Every interaction you have is, think of it, Big Brother watching you in a way. So, and sometimes even like interviewers will say that they'll ask like the receptionist and they'll ask different people, even students who've interacted with you, what they thought of you. So every interaction that you have at that school during the day of interview, it matters. And so you have to be professional at all times. Definitely, I would say bring a binder, bring notebook, bring something to write with, and take notes. Have questions. Take advantage of this opportunity because they're not only interviewing you, but you're also interviewing them. And the best, in my experience, the best way to really get to know a school is talking to the students themselves. Sometimes students will literally tell you, "Don't come here," and you have to take that and just know that they're, that's a sign that maybe the students aren't happy or admin aren't, they're not really taking care of their students. Like I said, be authentic, be yourself. The experience that you've had, nobody else has had. And then always follow up. Whether it's an in-person interview or online, you always have to follow up with your interviewer. It's just good practice for life. It could be an email or it could be a personalized note that you send to them through the mail. All right, so now let's get into financing your education, the most important question. So the most common way to do it is to take out loans. And I can confidently say for both of us, neither of us would recommend taking out loans. For the main reason, for religious reasons, at the end of the day, we're Muslims and, taking out loans is probably not in line with I would say like our religious values. And the other reason, even when we take religion to the side, those interest rates are very high and they can be really crippling. So regardless of the lens you look at it, we ultimately will not recommend taking out loans, but it doesn't mean that, I personally have taken out loans the first 2 years and I'm very honest about it. I do regret taking out loans. And I wish that I managed my finances in a better way and really looked into opportunities for me not to take out loans. And then during the last years, I kind of had like a shift where I was like, okay, like I cannot be taking out more loans. So what I did is I ended up taking out a scholarship, alhamdulillah. So I took out the National Health Service Course Scholarship, and that covered the third and fourth year part of my education. So a little bit about the scholarship is that it pays for all of your tuition. You get like a monthly stipend, but there is a caveat to it. You can't really specialize, which is fine. I didn't plan on specializing. So you have to do either general dentistry or pediatric dentistry. And if you decide to do, another year of it's like more experience training for general dentistry, which would be like a GPR. So that would be more in a hospital setting or an AGD, which is advanced education in general dentistry. They'll allow you to do that. So those are the only 4 things that you can do after you graduate with that scholarship. And essentially after you graduated, you are giving that time back by serving an underserved community. So they have specific sites all over the US and you have to work for those sites. It doesn't mean you're working for free or anything. You're still working there. You're getting a salary. It's just in an underserved area. So because that's the whole mission of the scholarship. They also have a loan repayment program. And essentially, I think they'll, if you apply for it and you get it, maybe you'll get like $50,000, but you have to commit to 2 years, and then I think $100,000 and maybe a 3-year or 4-year commitment. So that is an option for you. If you want to completely, avoid loans. Like I said, I did the 2-year program, but they offer 4-year scholarships through that program. The other thing is the FELS, which is the Forgivable Education Loans for Service. And this is unique to North Carolina, but I do think maybe if you, do your research and you can find other opportunities within other states. I only know of this one because I live in North Carolina, but they'll essentially give you $14,000 a year and you just commit to work in North Carolina afterwards. The other scholarship that I received was the HRSA scholarship. That one is purely based on financial need. So they gave me $2,000 a year, essentially just by demonstrating financial need. There is something called a continuous charity. This one I recently learned about, and it targets Muslim students who are, seeking education in healthcare fields. So they provide interest-free loans. Um, if I'm not mistaken, you apply and then you either have to raise the money or you receive the money. Don't quote me on it, but do look into it. And essentially you give them the money back after you graduate and you work, but it's completely interest-free. So that I think that's a great way for you to, avoid interest through that program. And then I would also do some research within the school or talk to school representatives about what sort of scholarships they have, because sometimes they have, they'll offer you scholarships just to attend their school. I don't know, you can chime in as in whenever talking about finance.
Yeah. There are definitely scholarship opportunities. They may not be as comprehensive as the National Health Service Corps scholarship or the scholarship that I have taken out, which is the health profession scholarship. But there are ways to try to kind of reduce your burden if loans are the only way you can pursue a graduate education. I mean, this is a very delicate and kind of sensitive area because, in me already have briefly had this discussion, but it is a little bit tough because there are nuances in terms of opinion in our scholarly class of in Islam of whether Muslims living in this land are allowed to take loans or not, or if it's encouraged or discouraged. And at the end of the day, just check in with your own morals and values and your ethics, because it is a point of it is a point of contention, and so there are differing opinions on it. And at the end of the day, if you're sincere about kind of your decision and you are operating with intention, inshallah, it'll be the right choice. And so I personally just wasn't comfortable with interest, and so I wanted to really get rid of that as much as I can. But it's really kind of up to you to kind of want to decide what it is that you want to do. I would recommend actually the National Health Service Corps scholarship, especially if you were interested in, like already said, just general dentistry or even pediatric dentistry. It's a great opportunity. I have a few friends from dental school who have taken out that scholarship, and so far they've enjoyed their experience. There is positives and negatives to everything, and so it's they're very grateful because the reason for why they took out the scholarship was to reduce their burden, and their burden was reduced. And I think because that goal was achieved, they're okay with whatever negatives were associated with the scholarship itself after they graduated. And so it's tough, and I really don't have the answer for this, but try to seek out scholarships as much as you can to reduce your burden, and just operate with intention, and hopefully, inshallah, everything will be okay.
I really like the part where you talked about sincerity, because I know so many people in med students who had, like you, were not comfortable about taking loans for the part about interest. And they had no idea how they were going to finance their education, but subhanAllah, things just worked out. And that just kind of reminds me of, when Allah says like, "وَمَن يَتَّقِ اللَّهَ يَجْعَل لَهُ مَخْرَجًا مِنْ حَيْثُ لَا يَحْتَسِبُ." So just focus on getting into the school. And, once you're sincere in your intention that you absolutely don't want to do anything that upsets Allah, then Allah finds a way for you to pursue that thing. And even with my personal story, like I said, I took out loans the first 2 years and I highly regretted it. And I was like, okay, I'm apply for the National Health Service Corps scholarship, knowing that I couldn't specialize. But at that point, I also wasn't sure at that point whether I wanted to specialize or not. I maybe was considering one of the specialties, but I was like, you know what, in the long run, at least this, this is, I'm gonna do this and make this compromise. But at the end of the day, it's for the sake of Allah. So I literally applied within a week of the scholarship when I found out, and then I applied. I had a week to put together an application and submitted it, and then I traveled abroad, I remember. And then I got an email notification saying, hey, like we need like additional information. It was some sort of form that I had to submit by a very tight deadline. But because I was traveling within that week, I missed the deadline and they took me outside of out of the scholarship. And I was like, you know what? Like at the end of the day, like I had the right intentions for this. If it didn't work out, that it's not meant to be. And then I came back to the States and I was back in school. And I remember like literally I was just in clinic and I had a patient cancel and I had nothing to do. So I was like, let me just like read some Quran. So by the end of that session, I just got an email and it was like, hey, like we've, deposited X amount of money into your account for the scholarship. And I was like, alhamdulillah, like if that's not a testimony, then I don't know what is. So just the point I'm trying to drive home is really like what Mazda said, when you're sincere in your intention and you're trying to do something because, like you want to please Allah, Allah finds a way to please you and for things to work out. So that would be the point I want to drive home. All right. So these are the questions that we received from our applicant or the people who signed up for this session. How to choose why dentistry for the personal statement, best way to practice interviews, and how many times the DAT was taken, best way to practice for DAT. So we got several questions. For the why dentistry part, I mean, you have to be honest with yourself. Like, what is it that made you interested in dentistry? And that would be a good starting point because then you can sort of, I mean, try to think back of that one moment of like aha moment. It was like, oh, actually, this is something I want to explore. And, it doesn't need to be like when you write your personal statement, it doesn't need to be like, oh, I was 5 years old when I knew I was wanted to be a dentist. That certainly wasn't the case for me. And that's okay. They genuinely want to see that like this is a decision that one you made as an adult and you really thought through. So it's okay when you're, writing that part of the personal statement, you kind of start with the moment that you became interested in it and then sort of develop the story in a way so they can see how that interest went from just an interest to an actual decision. So I think that's a great way to tackle that is just kind of invite them into how you became interested by telling different stories and experience that you had. It could be from shadowing, could be from volunteering, any sort of that stuff. The best way to practice interviews, we talked a little bit about that. How many times DAT? I took it once, but if you need to take it twice or 3 times, that's fine. I do know there is a limit that you can how many times you can retake the DAT. You'll have to look that up. And we covered how to practice for the DAT. I think we covered the second question too, about the GPA average. All right, what experience or activities would you recommend to a pre-dental student? I would like I said, get involved in research, do volunteering, both dental and non-dental related. Do experiences that you're actually interested in and stick to them. If I am a public health major, would adding a bio minor or major be better? I would only add a biology minor or any sort of minor or major if you're generally interested in it. The last thing you want to do is add a minor or major and then you're not interested in it or it's extremely difficult and ends up hurting your GPA. So that kind of would be my advice regarding that. There's no advantage to double majoring or having a double or in a minor unless you've done well in those majors and minors, in my opinion. All right. I think that's, and then this is our contact information if you want to reach us. And then we'll open it up for questions. I know we've been talking for a while. Feel free to put any of your questions in the chat.
Hi, this is Amani. Really very great information. I'm really glad, and now I'm thinking maybe I could apply to the dental school.
Never
It's
too
my PhD degree. But one of the question is, have you got like a skeptical feeling, like questioning your choice, like why I done this to myself? When you are going through the dental school, and was it hard to go through all of these classes and training and through all of these years, or you feel it worth it?
You want to go or should I go?
I'll let you go since it's still fresh.
Okay. Yeah, I'm not gonna say that there aren't times where I'm like, should I have done this? And I think that's normal. Sometimes I remember how many of my, I guess, like youth years I've dedicated to education, and sometimes that can get to me, but then I remind myself, like, what else would I be doing, you know? So I had to go through these years anyway, so I might as well get a, education out of it. But truly, really, when I do have my hard moments, I kind of remember what my motivation is. I think for me, I mean, I can speak all day about how I like many aspects of dentistry, but when it really comes down to it, for me, I think this is my biggest motivation is to be able to take care of my parents and my family. And I think that helps me a lot. And the other thing is when there are certain days when I go into clinic and I'm just so exhausted, my back hurts, and I'm feeling discouraged. But then I remember, like, when you're a medical provider or a dental provider, you get like ajr out of it. So I just kind of like, I'm like, I'm doing this anyway. Might as well set the intention like is to help someone improve their health. And then that also became another motivation factor for me to continue doing what I'm doing because I'm like, oh, this is like an easy way for me to get hasanat is by, providing dental care. So I would say those are two big driving factors for me. But it's fine now. I think the most lack of motivation I felt was my first year. And that's because we were kind of in the same classroom every day from 8 a.m. to 5 o'clock. Sometimes we go into like simulation lab afterwards. And it was hard to get gratification out of that. Like one of the reasons I went in dentistry is to be able to interact with patients. It's so nice when like, at the end of the day, like you get your patient out of pain, they're so grateful and you're happy you did something good. That kind of keeps you going. But when you're in a classroom for, so many hours every day, it's hard to see that. And sometimes you question like, why am I still in between all these walls? But it's gotten a lot better towards my third and fourth year when I started like seeing patients. So
Yeah.
That's great.
So SubhanAllah, I was on a panel not too long ago for um, these Sudani elementary school students, and I think some of them were in middle school as well, and they were kind of asking questions about. I think the topic or the prompt was time management, and they were, they asked about how do you deal with stress when time management goes out the window, and the way I answered it wasn't necessarily even to answer the time management portion, but it was just stress in general and kind of dealing with when things aren't going your way, or if you're just dealing with stress in the moment. And it's at the end of the day, it's realizing that nothing is permanent in all aspects of life, whether that's the emotions that you're feeling, whether that's the hardships that you're going through, whether that's the circumstance that you're in financially. I mean, you could be doing well and then the next minute you're not, or you can be doing not great and then your luck just kind of changed and your qadar changes. And it's I think it's just understanding kind of the finite nature of anything that it is that you're going through. And alhamdulillah, where I went to school in Maryland, I had a lot of Muslim people around me, whether that was in the dental school or whether that was in just the state in general. It's a small state and there's a lot of Muslims in the state. And so it was very nice to see how, like practicing gratitude and just kind of operating with intention and realizing that everything is finite. And that was being reiterated to me by my Muslim community has made me kind of be able to traverse whatever it is that I need to kind of get through in dental school. And to be honest with you, it is a fun profession. I mean, I didn't think that I was going to be a dentist growing up, but now that I'm on the other side of it, I'm very grateful to have gone through it. And you'll go online right now, and there's actually this trend on YouTube of a lot of medical students who are dropping out of med school, or like a lot of residents who are dropping out of residency, and it's been highlighting how stressful things are in like these types of fields. But there's also been the other side of people who have iterated, or have essentially said and responded that, while you're going through it, that's not the reality of how life is going to look afterwards. And so, dental school will be tough, medical school will be tough. Whatever type of schooling or training you're going to go through is going to be tough. But guess what? Like once you come out the other side, it's a lot better. But then there's going to be more obstacles for you to go through. And so never think that the stress is going to stop. At the same time, understand that like it's really important to just stop and kind of reflect and be grateful for what you have in that moment. And so I think that's just general advice that I would give, regardless of what field that you're going into.
Yeah,
This is great. Yeah, and it's an encouragement for our young youth to just go through it. Yeah, you're going to see the light at the end of the tunnel.
Yeah, exactly.
And it doesn't have to be your whole life. Like, definitely don't make whatever career you have, your identity. Like, there's more to life than just your career. So definitely invest in your family, your friendships, do things that, make you you. Like I said, if you make your career what you are, then the smallest things will get to you every day, and you are going to be constantly stressed out. I mean, I definitely see it with my classmates. I mean, because when you make it your identity, those small things almost become for you very personal failures and can start to affect your self-esteem and how you view yourself. So I would just say, like, just remember you're a whole person. It's your whole life, it's not just dentistry. So let's see if there are any questions in the chat. Haitham said, thanks for sharing your valuable experience applying for dental school, walking through the process. I hope there's a link for a recorded lecture. Please share, and we will tell young Sudanese students about it here in Minnesota. Oh, sound like Haitham. I remember. Okay. So he's from Minnesota, actually. Family and friend. Okay, yeah, we'll definitely share the link, inshallah, with you guys.
Dr. Reed, if there is no question in the chat, I have just one additional question to
Yeah,
Dr.
sure.
Manzil. I know, I understood that you took the military track and then you applied to